Hi everyone, my name is Gemma Ridge and I'm a counselling psychotherapist and I am also accredited in EMDR. EMDR stands for eye movement desensitization reprocessing, which I know is a bit of a mouthful, but this is a modality or an approach that is really often very effective with processing or taking out the heat of a traumatic event that has happened that is maybe stuck or is replaying whenever we are triggered. So I integrate EMDR into quite a lot of my work, and I'm now specialized in grief, loss, and trauma. And sometimes I get asked about how I integrate EMDR, whether I do when I don't integrate it. And so I just thought I'd do this little video. So first of all, it's really important to say that when we experience a loss, and that can be any loss, so we're not just talking about the death or the end of a life, we are talking about the loss of anything that's significant with an attachment. So that could be the end of a friendship, it can be the end of a relationship in the family or an intimate partner relationship. It could be the end of a job or redundancy or retirement. It could be loss related to infertility or miscarriage. So there's lots of different types of losses here that I'm talking about. And grief is a natural response to any loss where there is an attachment. So grief is how we feel, it's how we show up, it's how we experience the world, it's after the loss, it's the messages that we tell ourselves. Grief is all of those things. And there isn't a one-way approach to grief. I know that's really hard to hear sometimes, and it is really unique. So nobody's doing grief right or wrong. But there are things that can help, and there are things that can keep grief stuck or not even actually really happening. So EMDR is not something that is going to stop you grieving. Like EMDR is not going to take that away. It wouldn't do that. It shouldn't do that, even if it could. I know that it can be really, really difficult when we're grieving. It can feel like we will never feel any better, and it can feel really, really painful. And we do have to weigh that up if we're going to use EMDR, but we have to go through the grieving process. But EMDR can be really effective in my experience when it feels like the grief is being prevented or is stuck. This could be because the trauma around the loss wasn't able to be processed because it was traumatic. And let's be honest, if we're talking about the loss of a loved one, that is traumatic anyway. And you may struggle with trauma symptoms in the beginning. That could include things like flashbacks, intrusive thoughts. It could include things like nightmares, panic attacks, really severe depression. And over time, those symptoms should reduce if they are naturally healing through the grieving process. But sometimes that doesn't happen, and that's where EMDR can really, really help. And it's not about speeding it up, it's about allowing it to get started and to help you be able to connect again with how things are now. So that could be because it's not just about necessarily about what happened. It usually is also about, in my experience, about how a person has interpreted the loss. So in my experience, most of that comes down to a few things. They will often blame themselves. So I'm looking for negative beliefs around themselves. So it could be, it's my fault, so it's blame, shame. Guilt is often really, really strong, or responsibility. So I should have done more, I didn't do enough, it's my fault, I didn't visit them enough, I had an argument with them before. All of those examples there can have a significant impact on your ability to process your grief. If they are not worked through with softness and compassion, then they remain stuck. And that can really interfere with the grieving process. If you are unable to think about what happened, so let's think about it in the context of you've lost a loved one and it was really traumatic, and that then plays out in intrusive memories or flashbacks. If that doesn't reduce in time, it suggests there's something holding it stuck. And it can also mean that it's really hard to activate any other memories about that person. So you may want to think about them, but your brain and your body is almost instantly like taken back to the time, that really significant traumatic event. And so that is horrible. It can mean that it's really difficult, like I said, to access other memories. And understandably, it may mean that we feel unable to think about them. We may avoid or distract because it's too painful, understandably. So EMDR, by targeting the trauma, is not going to erase it, but it can take the heat out of it and the temperature. It can then reinstall that in a way that is more adaptive. And by that happening, usually in my experience, a person is able to also touch and tend to other memories that have been blocked by that trauma. So I hope that has helped explain a little bit about why I use EMDR with grief and loss, why I wouldn't use it, which is because, you know, you you may, because it's so horrible that you just don't want to feel. I get it, I totally do, and I'll support you through that. But grieving is really, really important. And it's a really important process that we all need to go through. But EMDR can be really helpful when that is really intense, and also it is keeping parts stuck, or when you are replaying. Sometimes when we replay, we add bits in. That's what the memory does. It tries to make sense. And so EMDR can be really helpful to kind of process that too. So I hope that's been really helpful. And yeah, please just get in touch if you've got any questions. But just before I finish, I just wanted to end on this. Sometimes people worry about having EMDR for grief and loss because they feel guilty. So it's not uncommon for people to say to me, I feel really bad for wanting to have EMDR because I feel like I should feel terrible for the next 2 or 3 years. You will still feel like, hopefully not terrible for the next 2 or 3 years. You are still going to struggle with and experience lots of different emotions, including sadness, regret, even guilt. That is not what EMDR is doing but it is giving you some respite, and it's also allowing you to access other memories and to have a little bit of peace, which you deserve. So it's not about you trying to rush through or forget. And if somebody's saying to me as well, like that they don't feel like they should have EMDR because they feel like they deserve to feel terrible, that is something I may want to be curious about and look at where that belief has come from because that is somehow connected to the grief, which is also stuck. So, yeah, I hope that helps if you're looking at this and thinking that may be really helpful, but I feel really bad about it or even disloyal. Please know that's not the case. You're just trying to take some of the heat out of it so that you can process and grieve more effectively. Thanks for listening.